Good afternoon, everyone. Thank you guys so much for volunteering for the First Ladies event. Together, we're going to be able to save lives. My name is Terry Campbell. I am the Program Director for Illinois Heart Rescue.
And my name is Marina Levios, and I'm the Community Sphere Leader for Illinois Heart Rescue.
So today, we're going to go over the very simple steps of CPR.
So there's 4 steps to saving someone's life: check, call, compress, and current. The first step, check for responsiveness. We're going to do away with, I know we're all a lot of you are health professionals, we're going to do away with checking for pulse, checking for breathing, all of that. All you want to do is check for responsiveness. Does the person respond to their name when you call for them? Pancho, are you awake? Pancho, can you hear me? Pancho, wake up. If the person's not responding, or if you hear them with gurgling noises or with noisy breathing or like a fish out of water, you have to assume that they are having a cardiac arrest. So you immediately want to activate 911.
So when you activate 911, if you are the sole rescuer, then you are going to be the person calling 911. If there's other people there, make sure that you're very specific with your instructions. You in the blue shirt, call 911. You in the red shirt, go get me an AED. That prevents everybody from having their cell phone out recording you trying to resuscitate this patient. The other thing that is also very reassuring is that many 911 dispatchers have been trained to recognize if a victim is not recognizing their name and if they're not breathing normally, they are to instruct the caller to do CPR. They no longer ask, do you know CPR? Do you want to do CPR? They actually take control of the caller and they instruct them how to do CPR.
And doing CPR is very easy. We've done away with rescue breathing for adults. Any person over the age of 12, you can just do chest compressions, and that is as good as doing chest compressions with rescue breathing. You want to provide chest compressions at 100 beats per minute, and when you're doing chest compressions, the correct position is you're going to find the breastbone on the patient's body, and you're going to go place your heel of your hand in between the nipples, so at the nipple line. You're going to use your entire body weight to provide chest compression. So you can keep your elbows straight, shoulders directly above the person's body, and you're going to compress 100 beats per minute and press that chest in half.
So it can be to the rate of a song like Staying Alive or Black Eyed Peas, Let's Get It Started in Here, something that's 100 beats per minute. You can see that Marina is also allowing for adequate recoil because we want the ventricles to be able to fill back up with blood. So she's doing a great job there. So the last part that we're going to talk about with our very simple training is using current or using an AED. AEDs are made to be ridiculously simple. If the rescuer simply turns the AED on, the AED will do the prompts and will walk the patient through it, or excuse me, walk the rescuer through it. So things that you want to be concerned about or that you want to keep as part of your education with the AEDs is that many lay people are afraid of them. They think that they have to be a healthcare professional to use an AED, and that is not the case. These are designed for people that have minimal English skills and do not have to read, so there's lots of visual prompts. When they turn the AED on, it will prompt them what to do. Marina will do a demonstration. One of the things that the AED talks about is not touching the patient during the evaluation phase of the AED. Reassure the rescuer they are not going to get shocked. You can only get shocked if you are wearing the pads. If the rescuer is touching the victim, it can interfere with the interpretation of the AED. The AED may be picking up the native heart rhythm of the rescuer and not of the victim.
So you'll have someone continue doing chest compressions throughout if you have someone to help you while you set up the AED. So all this time somebody's pressing on the chest to work the AED, all you have to do is turn it on. So find the on button, usually it's right in front of the device.
This is a training device only.
And this is a training
device.
device.
No shock will be delivered.
Find the pads in the kit.
Remove
Listen
clothing
for prompts.
from person's chest.
First thing, Remove the patient's clothes.
So it has to be on bare skin in order for it to work.
Attach pads firmly to person's chest as shown.
The pads are labeled with where exactly on the chest you want to place the pads. One over the shoulder,
Plug-in connector.
one on the side.
Check connector and pads. Analyzing rhythm. Everyone
At this
stand
point,
clear.
have people stop touching the victim and listen for instructions.
Shock advised. Charging. Everyone stand clear. Everyone stand clear. Push
Flashing
the
light
shock
is
button.
telling me that I have to press
Shock
the shock
delivered.
button.
Begin 5 cycles of CPR.
And you can continue doing chest compressions.
Okay, so it's very important that you remind the rescuers to immediately do CPR. And again, they're going to be afraid that they're going to forget the steps. Tell them to simply listen to the AED. So key messaging. You cannot seriously hurt somebody by doing CPR. Even if they have a native heart rate, even if they don't need CPR, you cannot hurt them. We want them to do continuous compressions until 911 providers get there. When 911 providers get there, have them let the EMTs or the paramedics know that they were doing compressions.
A couple of other things. If the rescuer gets tired, it's okay to swap out with another person. So you can just walk another person through the same steps that you've just learned. Doing 100 compressions per minute, pressing the chest in half. And I think that's...
I will be following up with everybody also with written instructions that you can print and bring with you. If you have any questions, please call me, 312-720-0835. Again, my name is Terry Campbell, or my email is tlc